in this presentation, what I thought that I will share two examples of knowledge co-creation, both in the Indian context. In both the examples, PRIA was the lead research organization, but partnered with a whole range of knowledge institutions. And most importantly, it partnered with local urban poor communities residing in various informal settlements in the national capital region of Delhi. So in my presentation, I will primarily focus on first, the collaborators, co-researchers, and the stakeholders. Who are these people and institutions, and why were they important to these two participatory research studies? The second is research objectives and research questions for all of you to get a sense of the context and the issues on which we spearheaded these two research studies. The third is participatory research process, the methodology that we adopted for the knowledge co-creation process, including the identification of appropriate research design, data collection, analysis, and dissemination. The fourth one that I would like to focus upon is using research findings for further engagement. And like any typical participatory research study, in these two examples as well, we were particularly conscious that the findings must be useful to the stakeholders. However, given the extreme power asymmetry that existed among the stakeholders, we tried to ensure some positive actions by the community members, even if these are initial, nimble, and exploratory. And lastly, I would like to share a few key lessons from the knowledge co-creation process with you, particularly when you co-design it with the marginalized communities. Perhaps some of these lessons could be useful in your context and for your studies as well. As you have noticed that I'm not going to share the nitty-gritties of the research findings as such. That might be shared on another occasion. So the first research study example that I'm going to use is a participatory research with adolescents living in urban informal settlements of Gurugram or Gurgaon as it was known in India. And the study was called Our Health, Our Voice. This research study was supported by the Center for Sustainable Healthy and Learning City and Neighborhoods based in the University of Glasgow and funded by UKRI, UK Research and Innovations. Our main research partner was Gurugram University, a public university located in Gurugram. Our other partners included Martha Farrell Foundation, a sister organization of PRIA, working in Gurugram with the women domestic workers, Community for Social Change and Development, a community-based organization working in the same locality with the adolescent girls and boys, and then DASRA, a national nonprofit that mobilizes support and funding for other nonprofits to work on the issues of adolescents and youth through their initiative called 10 to 9 DASRA Adolescent Collaborative, and Mamta, another national nonprofit that works on the issues of reproductive health. Both DASRA and Mamta were primarily engaged in the national convening and advocacy during the research and the post-research process. So the primary objectives of this particular research included one, from the perspective of the marginalized adolescents, inquire about the health needs and health education necessary for transition into healthy adults. The second was to examine how far the adolescents were engaged in planning, implementation, and monitoring of the adolescent-specific public health policies and programs, particularly a program called RKSK, Rashtriya Kishore Swasthya Karyakram in Hindi, an initiative of Government of India. And the third was to offer practical proposals for national and state policy and programs based on the existing successful models of engagement and knowledge exchange. So some of the principles that we followed in this participatory research included, number one, we wanted to make sure active participation and involvement of the community over the generation, elaboration, and utilization of knowledge. Then to provide the catalyst to bring forth initiatives among people in the community in a way that they collectively act to improve their existing situation. And the role of the outside researchers like us was crucial in bringing information to the community from different contexts and from other avenues in similar situation, but acted more like a facilitators. And on the right-hand side of these slides, you see the stakeholders who were involved in the study. Of course, the adolescents were the primary stakeholders in this research study process, but then we also engaged the parents and the other community members, particularly the decision makers who influence the lives and choices of the adolescents. Of course, the university was our research partner, but also we engaged the frontline health workers, school teachers, which have an influence on the adolescents' choices. In addition to that, as I mentioned, that we partnered with a community-based organization, and the study was intended to influence the national and local civil society organizations by engaging them in the research processes, but also the local governance institutions, the Gurgaon Municipal Corporation in this particular case, and the national and state level policy makers. So that's the list of stakeholders who have been involved in the process. The research process, we started with a mapping of the community resources and also a mapping of the city or district level health system, because the study focused primarily on the health choices of the adolescents. Therefore, it was important for us to know the existing health system and the programs which are operational in that particular city. But at the same time, what kind of health infrastructure existed in the community that was also mapped. And after this initial mapping, which also provided us an opportunity to interact with the community, then we started co-framing the research questions with the adolescents and then the university partners. And from the university, several faculty members as well as several students joined the research process. And then we started engaging with the study participants and the co-researchers to detailing out the research methodology and the sort of the process of data collection and how it would be an iterative process. Those were the themes that we discussed with different co-researchers. Before we proceeded further, we had to organize training and capacity building of the co-researchers, because as I mentioned that a lot of university students were engaged in the research process, and that was one of the deliberative choice that we made in order to accelerate university engagement with the university. But they were trained in conventional research method, but we were bringing a participatory research principles and methods, and therefore it was essential for the process to orient those university researchers as well as the faculty members in the research methodology, participatory research methodology. And once this is completed, as part of this process was to design a participatory survey, which was conducted or co-conducted by the community adolescents from the community, the university students, and this was guided by the researchers from PRIA and other partner organizations, and the university faculty members. And once this participatory survey was conducted in that particular locality, that gave us a better understanding about the extent of the issue. And based on that, based on the findings from the participatory survey, then we organized several workshops for data sharing with the community, the validation of the data. But in the process, we also interacted with the other stakeholders, particularly the health officials, local health officials, municipal officials, and also the community members. And these interactions provided us many additional insights. Once these additional insights came into light, then we are able to design a number of focus group discussions with different groups. So there was sort of discussion with the adolescent boys, adolescent girls, their parents, their separate discussion with their fathers, separate discussion with their mothers. So therefore, a whole lot of interaction took place through the process of focus group discussion. And once all these methods helped us to collect substantive and qualitative and quantitative data, based on that, we organized a number of learning circles. And now these learning circles there's two purposes for organizing these learning circles. One was to share the local data, but also in these learning circles, we invited other civil society organizations and the experts, health experts, who could share similar data from other contexts. And therefore, that provided us an opportunity to lift the data and to draw insights, not only from the local context, but also at the state level and the national level context. And once this is done, then we also realized that one of the options or provisions from this RKSK program was to have a adolescent friendly health clinic in each location. Unfortunately, these adolescent friendly health clinics were not operating as it would have been desired. So one of the exercises that we did with the adolescents was to map their aspiration, not only about the physical infrastructure and the layout of the center, but how this center could be a more like an engagement and learning center for and a kind of free-flowing discussion can happen between the adolescents and the health officials. So all these aspirations were mapped with the active involvement of the adolescent boys and girls. And once these all data came together, we started analyzing that data. And based on the findings, we organized stakeholder consultations both at the city level and as well as at the national level, because it was important to share the findings, particularly the operational learning from this research study with the policymakers and the policy designers at the national level, because it was a program which was primarily funded by the national government. But we also ensured that the findings are also used by the community. And there we also engage some expert institution to contextualize the knowledge and design social and behavioral change communication strategies and a lot of materials, which would be a kind of educational material for the parents as well as for the adolescents. But we also took care of the upstream communication, particularly through the writing of blogs, reports, research papers, and audio visuals. So that's the kind of research process that we undertook in the first case. The second example is I'll rather go rather quickly. It included breaking the vicious cycle, and here the focus was planning water security in low-income urban neighborhoods. that we undertook in one location called Ghata in Gurugram and Gautampuri, which is a resettlement colony in New Delhi. And this study was funded by the Adaptation Research Alliance, and our research partners included, of course, the communities from Ghata and Gautampuri, the two locations where the study was undertaken, and then Shaheri Gharelu Kamgar Union, or Urban Domestic Workers Union. They were also a partner. We also partnered with Shushan School of Art and Architecture and Urban Planning and Designing University, based in Gurugram. Then we also partnered with Indian Council of Medical Research, and within sort of various institutions in ICMR, we partnered with the National Institute for Research and Environmental Health. They are based in Bhopal, Madhya Pradesh. Then we also partnered with All India Institute of Medical Science, the Center for Community Medicine, and our partner organization, Martha Farrell Foundation, and the UNESCO Chair in Community-Based Research and Social Responsibility in Higher Education. So Martha Farrell Foundation and the Urban Domestic Workers Union, they were already working with these communities in both the locations. So they provided us access to the community and helped us to initiate the interaction with the community. So here the research focus was to understand the implications of uncertain availability and decreasing quality of water due to climate-induced impacts on the daily lives, livelihoods, and health of the urban poor communities, and then center the lived community knowledge of risks and vulnerability in future action research to inform stakeholders' actions towards inclusive planning for water security in low-income neighborhood. And the second research was a kind of preliminary research, and therefore there's a kind of follow-up plan to take up this issue in much greater length. But very quickly, the participatory research that we followed in this case, like the first one, we started with informal discussions with the community using various participatory appraisal tools like resource mapping, social mapping, transit work, Venn diagram. Those are visual tools which engages community to illustrate the problems, but at the same time, they also try to find solutions once the problems are identified. And in the second part, we organized several intergenerational dialogues, particularly on the historical trajectories of water. How in this Dhaka community, they have been living there for 50 years, and Gautampuri was a resettlement colony, resettled 20 years back. So they have a very different history with the water. So the availability, quality, and usage of the water was mapped through this intergenerational dialogue, and how over the years, the climate change has impacted the availability and the quality of the water, and the kind of adaptation that community is already planning or undertaking. Those things were discussed in this process. And then these university students who were trained in urban planning and design, they interestingly undertook a mapping called mapping of blue and green spaces. And here the interesting part was that they did in partnership with the adolescents and youth from the community. So this was also an opportunity to interact, to facilitate interaction between the adolescents from the community and the young researchers from the university. We also used a lot of art-based and photo-voice methods with the young and adolescents, and the method itself, encouraged the young people to come up with their photographs, their videos, using poetry, using drawings to illustrate the use and or misuse of water. Then once these processes were completed and the data were collected, we sort of collated the data collected from different methods, through different methods, and the study findings were shared in a meeting between the student researchers and the community researchers, and further insights were drawn from the existing findings. And towards the end, we also prepared a lot of educational material using the community and expert knowledge. And there we used the expert knowledge from the National Institute of Research in Environmental Health, NIRE, based in Bhopal, and also All India Institute of Medical Science. And there, the sort of scientific knowledge was used on the basis of the knowledge created by the community. So there's a kind of interesting blend of two different insights on the same issue, and based on that, we sort of prepared some educational material. So what can we learn from these two co-creation, knowledge co-creation process? First of all, it was extremely important that using the community's lived knowledge and localized data sets to influence the impact-driven research and policy making. And it complements the expert-driven research studies, but challenges the top-down extractive model of knowledge generation. The second is that the dialogue between the community and experts must be the basis for co-creation and co-learning. And this leads to the demystification of scientific knowledge, such as adolescent health or climate change, or complex water cycle, and so on and so forth. The third lessons that we learned in the process was, co-creation process generate energy among the community, particularly among the adolescents, youth, and students, to take action at the local level. And the next learning was the linkage with and investing in community-based partners is crucial in initiating trust shown by the community in participating in these co-creation processes. In the first case, the Community for Social Change and Development, and in the second case, the Urban Domestic Workers Union facilitated our introduction to the community, and they remained engaged throughout the research process. Downstream research communication, combining the scientific knowledge and the derived community insights in easy to understand language, generate further discussion in the community and other stakeholders. And these discussion is critical for local action, but also creating models of change, which then can be used for larger sort of policy influencing and national and state level policy initiatives. One of the learnings was that co-creation of knowledge brings with it the responsibility of how the knowledge is being generated, and also shared, and for what purpose. We need to ensure that the research does not become an extractive process. In most cases, the external researcher who come to the community, collect data, and they use for other purposes. But in the process, community doesn't get anything out of the research immediately or even in a longer term. The last lesson that we wanted to highlight is the community university engagement makes the university socially responsive, but this requires systematic investment in the capacities, not only to work with the community, but also to respect and recognize the community's lived knowledge about the issues. In both the cases, we have deliberately partnered with the local university with a hope that the relationship that we have been able to catalyze between the community and the university would continue, and the community would be benefited from the knowledge generated by the university faculty members or student researchers. But at the same time, the university and the student researchers would understand and respect um, the principles and the methods of participatory research.